Hello, Stroke Warrior friends and family. I'm your host, Ralph Cortez, and today on Stroke Warrior Radio's therapist interviews, we're diving into a crucial aspect of recovery, speech, cognition, and communication after brain injury or strokes. Joining us is Sarah Bott. Hi, Sarah. How are you?
Hey, good. How you doing?
Fabulous. Sarah is a licensed and certified speech language pathologist and founded NeuroCare Speech Therapy. She's got more than 8 years of experience in neuro rehab, which is really important for a lot of stroke survivors that they don't realize.
Mm.
She's helped countless survivors of stroke, TBI, LIS, ALS, and Parkinson's reconnect with their voice, their thoughts, and their loved ones. Let's explore a little bit on specialized speech therapy and how you bring about confidence and healing. What inspired you to specialize in adult neuro rehab and focus your practice on conditions like stroke and traumatic brain injury?
Yeah, so the reason I wanted to focus on it, and really what inspired me, is really just all of my past life experiences. My family member had a stroke, and I have had a concussion.
Oh,
A One of my best friend's fathers, had ALS. And so I kind of just had this, life experience with all these diagnoses. And that was my focus in my education and my master's and in my career, since I graduated. And so all of that experience and being involved in all these populations, you see a resilience and an ability to improve someone's life. And so all of that really led me to make that be the focus because there's a lot of pediatrics out there, for speech therapy, but the impact it can have on adults is life changing.
yeah, absolutely. Can you tell us a moment? I understand you worked for somebody for a while, and then you realized neuro speech therapy was needed. What gap
Yeah.
do you think you were hoping to address?
So a couple gaps actually, because I had two very different experiences, two past jobs I had. One was a hospital system, outpatient neuro rehab. And then another was a virtual speech therapy company. And so I could see these benefits. Obviously, outpatient neuro rehab, they have specialties, they have a focus, they're really good at what they do with certain populations. And then this virtual company was all ages. But I did see the benefit of having just flexibility and the ongoing support in between sessions, having a plan, if somebody is graduating from speech therapy and just the involvement in someone's life just had a more personal touch and really was, into their actual daily activities and what they do and what they want, and their relationships, their family, their home. And so being able to bridge the gap there and make it very functional and personalized was something really important to me. And I saw how that really worked with, having that virtual option, um, or just involving the family more and being able to text your speech therapist in between sessions and, get kind of that advice and get that help and assistance. So I wanted to play a more integrated role in these populations, but also bring the specialty because we're supposed to be generalists as speech therapists, and that can be hard if you don't have experience with someone in the past who's had a stroke or who has ALS or a TBI. Then you're going to have to go back to the drawing board and remember everything from grad school. So that can just be tough. So I think starting off with the specialty, but also the increased access and flexibility is what I wanted to see achieved.
Impressive. You're building community out there, aren't you?
I'm trying.
That's what it sounds like. That's awesome.
Thanks.
Um, the next area is kind of near and dear to my heart. Um, for stroke and TBI survivors who may not know, what kinds of communication or cognitive challenges might they face after brain injury or stroke?
Yeah, absolutely. Cognitive wise, that could look like memory. And there's even several aspects within that. Short-term memory is different than long-term memory, is different than working memory, which means, what can I recall information in the, right now that you're telling me. There's immediate memory. There's all these different types of memory also, and that's a big part of cognition. And then there's concentration, being able to focus. And that is actually the foundation to memory. Because if you can't focus on what someone is telling you, then that information won't be stored. And then you won't be able to recall that at a later time or when you need it most. And even within concentration, there's several different types. There's how long can you focus on a task? Can you focus on a task with distractions in the background? And can you do two things at once? We may call it multitasking, but maybe clinically we call it dual tasking. So there's all these different areas within that, or even just your processing speed, feeling like I just can't process information as quickly and as effectively as I used to. In terms of language, that could look like word finding, just trying to bring the word forward that you're trying to say, or maybe what you want to say, but something else comes out that you didn't intend. And so language would look like that's the diagnosis of aphasia, and that could be receptive, as in what I understand, like I can understand what you're telling me. And then there's expressive of can I say the word I'm intending and wanting to say. Um, and then there's even apraxia, which is more the motor planning of can my mouth, my lips, my tongue, can everything be in the exact place it needs to be to make a certain sound? And my brain might be saying, say your name, say Sarah, but my lips are not getting in the right, part. Maybe it's doing instead of sa. And so kind of working through how to help the motor plane of your brain, that's apraxia. That could be another area that could happen after a stroke. There's, more on top of that as well. If you think of visual changes, and stuff like that.
Do you find, and I'm asking this because, like I said, you're building a community type thing. Do you find that there's a lack of referrals and education for the patients to speech therapy? And in my case, it took me 7 years before I got a speech therapist.
Oh my
I didn't
goodness.
realize I even needed one,
Mm,
uh, and I found I had swallowing issues. So, I
oh
mean,
my goodness.
do you find I mean, people think of speech, but they don't think of the cognitive, they don't think of the swallowing issues. Do you find there's a lack of
Exactly.
education and referrals?
100%. And that's a big piece too of what I want to do and am doing really is that education and networking to physicians and PCPs. And again, people that they only know what they know. They only know what they've been taught. And being able to kind of give that extra piece of information that it's not just for speech, but it's, is someone struggling to find their words? Is someone kind of just stumbling over what they're trying to say? Are they losing their their thought process? And are they forgetting things they didn't normally forget? Those are kind of the more functional application pieces that I do think people look over. And maybe a doctor's more focused on, other aspects that are absolutely important and they need to be focusing on, like your heart or your lungs and, all these other things. But I think those things can kind of take a back seat. And that can be really big for somebody's health, their well-being, their social interactions, their sense
Their
of
mental health?
quality, their mental health, exactly, their value, their sense of value and worth. And so it can be really attached to everything in their health. So I think it is something that needs to be more educated and advocated for.
Well, I hope we can do that with Stroke Warrior Radio. We keep trying.
Yes, yes.
What's the Is there a difference between speech language therapy and general cognitive therapy?
So, yes, someone may only have a memory or concentration issue, which would be the cognitive piece. So, I might assess someone and they're not having any major changes to their language. They can understand and express themselves the same that they could before their injury. But it's just the memory aspect or the processing speed aspect that remains. So that would be what we would just really focus on is the cognitive therapy. And then, of course, it can be the other way around. Maybe they've just, lost their ability to understand complex conversation or just understanding, their loved one and what they're trying to communicate to them and give them, directions or whatever it may be. And so that would be more of the speech language side. So sometimes they exist at the same time and sometimes they exist separately. It just depends on where in the brain the injury was.
Curious about your approach on cognitive. What kind of therapies are there for cognitive issues?
Yeah, so there is compensatory, what we would call, where you're going to learn strategies that can help, and maybe it's not a strategy that you'll need forever, but a strategy for at least now to help you function in your everyday life. And then there's the restorative aspect, which is going to be, stimulating those parts of your brain that sometimes I explain it like it's under construction. It's a road that just has a little construction. And we need to, rebuild that road, that pathway in your brain. And so a lot of that is going to come from repetition, certain intensity, certain carryover, and kind of a multifaceted, stimulated approach to really help that pathway rebuild to the best that it can build towards. So
Okay.
both restorative and compensatory strategies, exercises, I guess I should say for the restorative piece, more like
Yeah.
exercises.
Is that like handwriting exercises? Is that like talking exercises? What, give me an example of it, one of those.
No, that's great. So some of it might look like deductive reasoning. I like to make it very functional. And so I'm like, okay, like you used to love to travel and it's really hard to plan a trip now since you're, stroke or brain injury. Let's plan a trip. I'm going to give you the instructions. I want you to use your strategies. I want you to try to, go online, research all the information you need to go away for a weekend to Hawaii or whatever.
Yeah,
um,
right.
and it could be something as functional as that. It could be something a little more, or a little less, maybe abstract, a little more concrete of we are, going to be doing maybe some of the more classic things of like, doing like a maze or doing an alternating attention exercise where I'm going to be asking you questions while you're doing another task. I want you to listen to a podcast while I interrupt you or while there's other background noise going on. I want you to um, there's so many things. There's a game I actually
Yeah.
really like called Blink, and it's a processing speed game, and it's also a visual attention game. And so even something like that of doing that with a loved one, or when my sister had that's who in my family had a stroke in the past, and she's recovered, she's doing great. We had like I made like a whole entire like binder full of different activities. I mean, there was math, there was, money exercises, there was, just anything that would really make her think and challenge herself. So it could be something as simple as that, like deductive reasoning exercises, mazes, um, stuff like that.
Okay. Awesome. That's amazing. Let's talk about neurocare for a minute. Walk
Yeah,
us through a typical, well, first of all, what should a patient be looking for in a speech language pathologist, especially for
great
stroke?
question.
I mean, like I said before, neuro rehab is so important. It's different than rehab.
Right.
So
Absolutely.
what should we look for?
I would say look for someone like, again, if it was me or a loved one, seeking a speech therapist, I would say find someone who has the experience and background in this area. Find someone who has the training and who has this not as just like a brand new thing they're trying to figure out. I think that just helps the progress just start off on a really strong foot and helps the assessment and the discernment of the speech therapist be able to set them up for success as best as possible. So, going to someone who's experienced, I think, is number one and specializes in this. And two, someone I would say I would want to find someone who is almost, I guess the word is creative and more like holistic and not just kind of like cookie cutter type of
Yeah,
therapy. Like what someone who is going to be really interested in your goals and your interests in your vision for yourself. And then someone who's going to be honest about, how to move forward and what would be achievable, but also what would be empowering to the individual. So I think just someone who can handle, you know, kind of conversing about what that progress looks like and just very interested in how to help them achieve their own goals in their everyday life.
that's called developing relationships.
Yes.
It took me quite a while to figure out I was the captain of my own team. I could
Mm,
get, I could fire my therapist. I can go out and interview new therapists. I think
right.
that's so important. Go to the facility, talk to them. They'll be
Yes.
willing. You're willing to have them interview you, right?
Right.
You know,
Exactly.
that relationship is became real important for me, and it made my
Yes.
recovery so much better.
I
Like you
get it.
said, the cookie cutter. I had therapists put me on a bike and walk away. You know,
Oh,
it doesn't work
no.
like that. You know,
Mm-mm. No, it does not. Yeah, I
take us,
agree.
yeah, walk us through a typical first visit or virtual session with your neuro. What can clients expect?
Yes. So when you first come to see me, our first visit is an in-depth evaluation and assessment of what areas, they are most concerned about and what areas they want to see progress with. And we, start with, we include a standardized portion to that, which is very helpful because that guides me as a therapist to know this isn't, an age related issue. This is more of a, change that goes beyond that to their cognition or language or, whatever it may be. So that's helpful to see because, as we age and just as being humans, we're gonna have gaps, in our memory and in the way we communicate and speak to people. So we want to see, what's kind of a more standardized approach. I think that's important. So we're not just guessing. But then I also very much include again that personalized approach of, what do you want to do? Like tomorrow, if you could wake up and say, this is like the one thing I would like to make progress in, what would that be? And I often say, it's not about perfection, it's about progress. It's about the process, not the product. And
Yeah.
so, if your goal is to order a meal for yourself, then what are the things we can do to move towards that? So standardization just helps guide what the real, gaps and concerns are objectively, but then also very much discussing what are you interested in? What's your life like? What are your, relationships with others like? What's important to you? How can I back you and be your advocate? So so it's really both and to help evaluate what the most appropriate and empowering really goals are for that individual.
Hmm. There's a little bit of a difference in my I think that you work with a wide range of diagnosis. How do you personalize care for someone post-stroke versus TBI related executive function.
Yeah. And so, in a lot of that, some of those things, like some of the concerns or deficits may overlap between those two people. But what is it they want to see? What are they working towards? Are they working? Do they want to go back to work part-time? Are they in school? Are they just wanting to get back to a hobby? What was their life like before and what is it like now? And what are they missing? Like, what do they want to see? So in a lot of ways, it's like the deficits could look, similar. And with those two diagnoses, I might use different assessments just depending on what their concerns are. But some of that, especially the cognitive, may overlap. But post like brain injury, let's say a concussion or TBI, there are going to be different things that are sometimes involved in that might not typically be involved in a stroke and vice versa. And so, I might not have certain symptoms on my mind when I'm meeting with someone who had a stroke, and vice versa. I might not have certain symptoms on my mind if I'm meeting with someone who has a concussion, just depending on their diagnosis and what I know different subtypes and different typical common experiences or symptoms are from those pieces. So a lot of times, like post-concussion, symptom management is a huge aspect to manage the symptoms that come up, like the increased headache during a cognitive task or dizziness or nausea that could come up after a concussion. That might not be as typical post-stroke. It could still exist. But yeah, so we approach it just kind of based on that pathology too, which is helpful.
How do you include family or care partners in the recovery process?
This is probably going to be one of my favorite questions because I think it's so important and I just don't even know how to explain it. Like supercharges your recovery, like it's like Energizer Bunny for your recovery. I mean, I I make that, very clear at the beginning that I want to hear who is important in your life. Who do you talk to often? Who are your people? Who's your support people? And what, following the patient's lead, what is your, desire in how much they understand and how much they can support and help you. And then based on that, if they're like, it's just going to be a different approach. If they're like, oh, like my brother or, my mom or my friend, like that's the person I want in my corner, then that's, who we interact with. And I want to get them to a place where, and I've said this before, to caregivers, and it's like my favorite like milestone is you're becoming like a mini SLP. you you're catching on, you're getting it, and seeing the caregiver implement the strategies. Maybe it's someone with aphasia, they're trying to explain something, and the caregiver is starting to learn. I can't just jump in and speak for this person. I need to wait. And to see that and knowing that they're catching on and they're implementing that strategy to benefit, the client is really exciting. So that's, one example, and there's many more, but yeah, I very much want to include them. And I like to provide that education to the client as to why that's important to their progress and how it can help, even make it further than it would be without maybe the support people in their life. So that's something I'm really passionate about because I've seen it. I've been there as a caregiver and helper to my sister, and seeing how me and then my dad, who's a psychologist, and my mom, who is a nurse, we all got around. We were able to do such awesome continuity of care for her. So it wasn't just the 30 minutes here or there, that you got the information, but she went home and, she was working, on these different cognitively challenging tasks for, her specific concerns. And so, seeing that and how much it helped her progress, I'm sold for life of how important that is.
It's kind of a lifestyle thing that,
Yes.
we our life has completely changed because of a stroke or TBI or whatever.
Right.
And it's
Right.
like We have to find, I don't like new normal. I'm so sick of hearing that, but you have to find what your life is now.
Exactly.
You
Yes.
know,
And
I
there's
found,
a lot. Oh, go
go ahead.
ahead. Go ahead. Oh, I
I
was
was
just
going to
gonna.
say, I found that doing things I used to do, even though it looked ugly, got better and
Mm,
better as I did them. So,
right.
there's an example of, fighting for yourself, I guess. I don't know.
Yes, I agree. Well, and I think there is a lot of emotions that comes in with that too, right? I mean, that is a huge piece. And, obviously I'm not a counselor and that's not, my scope, but that's something I advocate for them to make sure that's something they're taking care of and they're getting what they need to kind of talk that out. um but also really validating that it is, especially for the client, what a big dynamic change that is. I always say there's a learning curve, like there's a huge learning curve here, and it is just it is something that can be frustrating or embarrassing or overwhelming and stressful. And so that's why I think what you mentioned earlier, the relationship with the therapist is so important, because you want to minimize those things being very involved, right, in recovery. And you want to have trust there so that that's not as distracting as it, could be to their progress.
You also offer teletherapy. What's been your
Yeah.
experience with telehealth-based speech therapy for brain injury survivors?
Yeah, it actually is very interestingly helpful in
Really?
ways that I think at first maybe I was a little skeptical about, to be honest. But to see, and of course, it all depends on the needs and the severity. And if they needed additional equipment, there's always going to be, those that are maybe more appropriate for in person. But what's nice about telehealth is it doesn't have to be 100% telehealth, it could be a hybrid. The first, meeting could be an assessment in person. And then we want to do 3 meetings a week, but that's really hard transportation wise. So we do once in person and 2 virtual. We can make it flexible so that it just really supports what they need throughout the week. And I think seeing, like, having a little window into their home, into their daily life, into their routines, how their house is set up, even the environment, can be really helpful for me to know how to help them carry over the skills that they're learning with me.
Beautiful. Cognitive connection and hope. Speech therapy isn't just about speaking. It's also about rebuilding confidence in relationships. Can you share, without breaking HIPAA rules, a story of a survivor who made a breakthrough in a way that really surprised you with your treatment?
Mm, this is what I have to make sure I don't get too emotional. This is what really hits my heart. One, because I almost feel like there's a moment like that with like every patient I've seen. But
Right.
secondly, because there's some like just really meaningful, and I'm like, maybe it doesn't sound that meaningful to other people, but to me in that moment, and knowing what it meant for the client, it's just like, oh, it's just really cool. And the the example I can think of is this sweet, sweet stroke survivor. And her goal was to make a phone call. She lived in more like a community where there was, maybe packages were delivered, like a condo area, and there was, an office or something that packages were delivered to. And she knew that someone was going to be sending her flowers. And so she wanted to make the phone call and check in and say, hey, are my flowers there? And if they're not, I want to give you a heads up, they're coming, and that I'm going to be the recipient. And so, we worked on kind of just like, again, kind of starting more concrete, the scripting for that conversation, what that could look like, and then building it more and more challenging to, let's try that conversation together in a quiet, secure environment. Let's try that conversation with an unfamiliar person. So let's have my colleague come in and try that conversation with them to kind of help, figure out and navigate maybe the nervousness and that kind of stuff. And then we'll, jump to that phone call. And then she made the phone call completely independently. And she, had her visual tools in front of her and the things that were written out that would help prompt her when she felt stuck. And I was just so proud. And she was just beaming. She hung up the phone and was just like, yes, I did it. And I was like, yeah, you did. And just boosting that confidence too, I think is so important. And so key.
Yeah,
So that's an example where I really just felt happy to see the functional, we did it right in therapy. Let's call that office right now. You tell them those flowers are for you, no one else. So
yeah, right. That's cool. Many survivors feel frustrated when progress is slow. How
yeah.
do you help you? I mean, one of the things is we don't ask enough questions
Mm,
as patients, because again, cognitive issues, frustration, depression, we don't
yeah.
ask enough questions. But how do you help clients set realistic goals and maintain motivation?
Yeah, that's such an incredible question. I feel like I could have a whole 2-hour class just on that, to be honest.
Good. We'll do
But
another interview for that
oh,
alone.
it sounds great. That would be incredible. But I would say it's a several ingredient answer. But to be as succinct as I possibly can, I think one aspect is just the validation of where they're at. That's something every human needs. I think to feel just I'm understood, I'm not alone, someone's in my corner, there's hope, right? To break through to that hope aspect. And so validating and understanding, because it's very valid to be frustrated about something like that. Totally understandable. And I think also, introducing things that are very meaningful, very salient to the person, what's going to be important to them. I could come in and say, yeah, like let's work on these type of exercises, but they're like, the biggest thing I want to do right now is, order my own coffee at Starbucks or have a conversation with my aunt who, or uncle that I haven't spoken to in a while with confidence. Like that's what means something very deeply to me. So, focusing on what that is and including that in care can be really motivating and helpful for that. Um, and also, I think this goes back to what I originally said about what you want in an SLP is someone creative, someone who isn't just going to do something boring and something rote and something that really won't translate to their everyday life. It's like, my husband, he works out a lot and he always tells me I don't work out as much, so I don't really know, but if you just do bicep curls, eh, what's that really going to do for your whole life? How's that really going to improve your health? And so that's kind of how I see it is, to see the moments where they are accomplishing something they didn't think they could, that is going to be so important. And so getting to those moments and encouraging them to celebrate that and not just gloss over it, is a really big piece of making it more holistic and more creative so that it's not boring, it's not distant to what really matters to them, and it's not um, personal and genuinely helpful. And some of that creativity is collaborating with other people and collaborating with, being engaged in new technology, being engaged in new research, and saying, hey, just so you know, here's options. It's your health journey, but you only know what you know. And so I want you to have the knowledge and information so you can seek out, and I can help, you do that to what could really help break through these plateaus or address this certain issue that has existed for a long time and is still struggling.
Yeah, my catchphrase is catch the wave. Warriors achieving victories every day. It takes a
Mm,
long time to recognize those small victories that add up,
yes,
you know. What
100%.
so many of us are told this is as good as it's going to get. What
Oh,
role, I know, right? I want to punch therapists anytime they say that. What
oh,
role does neuroplasticity play in your work? And how long can progress continue after stroke or TBIs?
Neuroplasticity is pretty much central, and it's the center of all of this, and of the research and the science to progress. And I actually had, my sister had that experience too, where we had a doctor, I think he was in training, but tell us like a couple weeks after,
Yeah.
like that this is as far as it's gonna get. And that was so, oh, like so awful. And so I was like, you know what? I'm gonna prove him wrong.
Yeah,
And
exactly.
and even, recovery honestly is lifelong. It really can continue. And a lot of it is just going to be, are you working on it? Are you participating in the things that can challenge you and grow you and make the progress? Like that's more of the question, like rather than, oh, after 5 years, you're not going to see anything. Like that's just not true because that's not how our brains work. That's not neuroplasticity, like that's not what we see. Of course, I'll say caveat in a diagnosis that is recoverable, of course. There's going to be certain diagnoses, such as ALS, that are degenerative in nature. That is a different story, right? But if we're talking about brain injury or talking about, post stroke, those things are recoverable diagnoses. And so that is something I've even seen years and years post stroke, kind of seeing these changes. And progress just isn't linear. It's just not that way because our brains are not a computer or a machine. um there's going to be moments that you feel like, okay, I'm seeing the progress and it plateaus, but the plateau isn't the end of the line. The plateau may be there, but what if the next day, the next month, you see that progress again? So a lot of it is just that, like, don't give up nature, and that continued cognitive stimulation and challenge and engagement. Once we lose that, that's when we're in trouble. So yeah, I would say it's way less about a time frame or timeline and so much more about the, you know, the involvement in your recovery, that each individual, gets the choice to make.
Yeah, and the power of the brain is an amazing thing. I mean, they told me I wouldn't be off the cane ever, and 6.5 years later, I lost the cane, you know.
Oh my gosh.
So
That's such a
it's
great example. I'm glad you share that.
yeah, it's amazing the people I see that I had one friend, the doctor told her you're going to be in that wheelchair the rest of your life. Today she's walking with a walking stick and can do a treadmill and everything, and it's 10 years.
Oh
So
my gosh. That should
there
just
is
be
hope.
something that is scrapped from everybody's vocabulary. Like that's just
Exactly, especially in the
very
hospital. That's where you hear it most.
right.
What tools or techniques or technology do you frequently use, such as what do they call it? Augmentative alternative communication apps or adaptive tools?
Yeah,
What is
that's a
all that?
great question. And I love we call it AAC for short because it is a mouthful. And so I am an AAC specialist. I love AAC. And so yeah, something that I use a lot of are different apps, for communication. There's ones, there's a whole kind of list of ones that you can get either for free, or there's ones that you can get that you can put pictures and words if you need that. There's ones you can get through insurance. That could also be a whole other episode. Would love to talk about
Yeah,
that too.
yeah, I'd
Um,
love that.
yeah, but that's something I use a lot of if that's needed for the client. If not, then there's, cognitive apps that are really helpful, or just language apps that are helpful for more that exercise piece to exercise those skills. Um, and in terms of equipment, and I do a lot of stuff with memory and training people on how to use their phone, how to use, just equipment they may have, like an Alexa or a Google Home or whatever it may be, to help with memory, things that I use all the time, like reminders on your phone, and just maybe that hasn't been something that they or someone else hasn't slowed down enough to show them, and could be such a lifesaver. I mean, I use my phone every day and I'm like, hey Siri, remind me to take out my trash in 2 hours, because I know once it gets to that time, I'm going to be tired and I might forget. And so even something like that is so helpful.
Yeah. Are there any emerging trends or technologies that you're excited about?
Oh man, again, whole other episode for this, but try to be succinct. I'll say two to be succinct. AI voice banking for clients with ALS. They used to have to just record their voice. Now they can get recordings of their voice from the past, and then AI creates a synthesized voice for them, and it sounds incredible, 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 incredible. That's really cool. And then the other thing, I have to choose one more. I would say this is still kind of experimental, but it's very interesting to me. It's called BCI, brain computer interface, and it's something where they're again experimenting and seeing, but kind of getting the electrical signals in your brain to be something that translates to being able to, select something on a screen or to speak. That still sounds wild to me, and I think
Yeah.
it's still very much in the works, but I've seen snippets and done some research on it. So maybe one day that'll be a thing.
Yeah, I've seen a couple studies that they're doing with computer chips in the brain now too. It's like,
Yes.
whoa,
Yeah,
this is this is getting scary.
I know.
What do you wish more what do you wish more survivors or doctors knew about the value of speech language after brain trauma?
Mm, that it is so much more than just speech. It is so much more than just speech, because that's the question I get all the time. Why are you trying to talk to me? And my speech is fine. I
Yeah.
hear that all the time. And so I think, yeah, just knowing and understanding that, is somebody, do they feel like their concentration or their ability to process information is different in any way from before the injury or the event? Then there's a need for me. Like, is there any change in their ability to independently do what they want to do? Then I could be, of use to that client. So it's kind of just like really seeing those small functional pieces, that maybe people just think, well, I guess I'm just gonna have to live this way. Then I'm like, no, no, no. Like, we can work with that. Like, we can, get you strategies that are just like so relieving to the client and the caregiver, and we can help restore, um, these aspects as well. And so I think there's just so much education to doctors, especially, that's needed on, no, speech therapists don't just, help someone talk. We don't just help kids with their R sounds. Absolutely, we do that, but that's not all there is to the story. And so I think just explaining all the different aspects of how we can help someone live independently and improve their quality and enjoyment in reaching their goals in their life, um, then we can be of use.
Okay. One of the things I found too is as a patient, finally discovered the only dumb question is the one I don't ask.
Mm,
You just got to keep asking questions. I mean, I said something about I was a contractor before my stroke, being
mm,
on a ladder. People are
mm.
probably sick of hearing this story, but being on a ladder. My therapist brought a ladder into therapy for me to
Wow.
climb on. Yeah. She
Wow.
brought a football in to help me throw it. Those kind of things. If you don't ask those questions, you guys can't help us.
Right.
You
Right.
got to
Exactly.
fight for yourself, darn it.
Exactly. I
What are
love that.
some, what are some signs someone might benefit from a speech language evaluation, even months or years after their injury?
I would say, if you personally feel like there is an area that you're like, I just don't think I have the tools to understand how to go about this barrier. I know that sounds so general, but like that can apply to so many things. Like, how can I like, how can I find the word I'm really struggling to say? Or how, when I feel like I get kind of tongue tied and trip over myself when I'm talking, how can I slow down? Like, don't just be, like, oh, that's just the way it is and give up. Like, what are areas you just don't feel like you have the tools in when it comes to your brain, your mind, to navigating and managing your life? And then at that point, even just something like that, as simple as that could be something I think that warrants an evaluation. Um,
Okay.
and even if we feel like, oh, this is more, this specialty or whatever, like we'll give that referral. We'll direct you, to that person that can help. But yeah, I'd say anything you feel like you're not satisfied with as the patient, as the client, that you want to learn and get more tools for when it comes to memory, cognition, language, swallowing, all those areas.
Couple quick ones for you. Most underrated brain rebuilding activity.
Oh my gosh. Um, Okay. I think doing two things at once, anything you can
Okay.
multitask. So walking and naming 20 restaurants, doing your laundry while you're being quizzed about, I don't know, a book
Yeah.
that you and your husband have read, whatever, like doing a cognitive task at the same time as a physical task. So good because it's multi, it's getting at several parts, of your brain. And that can
Right.
wake up places in your brain better than just hitting the cognitive or just hitting the physical. But when you engage them together and do them at the same time, that's really powerful. And sometimes it's something like that can help that construction zone get a little smoother and get a little easier to complete a task.
It's the best I've ever heard it described.
Oh,
Favorite
thanks.
favorite therapy app or tool?
I really like oh, which one should I say? Luminosity is good for cognition, and I love the Tactus therapy when it comes to speech. So
Okay.
those are my two faves.
Okay. One thing every caregiver should say daily.
Love this. Um, what you say and what you think matters.
Okay. What gives you the most hope in this work?
My patients' attitudes.
Okay.
I see attitudes of such hope and such endurance. And I feel consistently challenged, and I just respect and admire the attitudes my patients have and the willingness they have to throw themselves in to their recovery. I mean, it is incredible, and I take notes on what people tell me, what they say to me, because it's changed my life in a lot of ways too.
For anyone listening today who feels stuck in their recovery, what would you say to them?
I would say there is so much out there for you. And again, you only know what you know. And so there's more ways to feel unstuck than you realize. And I am here to help. Therapists are here to help. And secondly, advocate for yourself. Do not be ashamed to do that. That is good. That is awesome. That will bring you, the progress you want to see and just give you hope. So advocate for yourself in every situation.
Well, how can people connect with you? Schedule a consultation maybe, or learn more about neurocare speech therapy.
Probably the best place to start is my website, and that's www.neurocarespeechtherapy.com. And there's a button front and center where you can schedule a consultation. I'll give you a free consultation, 15 minutes. sometimes goes to 20 or 30 minutes, but where we can chat and just talk about if this makes sense for you, if it's something that will help. And that free consultation, that's something I will continue to do the rest of my career. So that's something
Nice.
that I'm not going to have go away. And I'm happy to help, even if it's just giving advice, in that, time, or redirecting to a referral source, I think is really strong for them. I want to make sure that it's something that's worth their time.
And you accept those free consultations from anywhere, right? In the United States?
So yeah, I can do a free consultation anywhere in the United States, even if
But
that might
do
not
you do
mean,
patients that way? I mean,
so that yeah,
okay,
no, you're good. That might not mean I can schedule an assessment with them, because since I'm only licensed in Ohio, I can do anywhere in
okay.
Ohio for ongoing treatment and therapy. But I would absolutely talk to someone in any state who's just as like, does this make sense for speech therapy? Can you direct me somewhere? My goal is to support anywhere and everywhere needed, and to meet that access that I feel like is missing. So, yeah, that's something I could do anywhere. And then in terms of treatment, that has to be done within Ohio with my license. However, there is something exciting coming up. It should be this summer, where the American Speech and Hearing Association is making a deal right now where if you're licensed in one state, that there's going to be several others, maybe 30 others, that therapist can, see clients or patients in. And so that's going to be something that, we should definitely keep an eye on, because that's something I'll want to be a part of for sure.
Yeah, exactly. Anything else you want to add today, Sarah?
Just thank you for having me, and for, just giving a little piece of, what you do to this area and to my practice, and I appreciate it.
Thank you so much. I have really enjoyed this interview, so I appreciate your time. Have a great day.
Thanks, you too.